All right, welcome everybody to Dueling Scalpels. I'm your host, Dr. Abhishek Barmar. In this episode, Dr. Corey Campbell and I continue our conversation with the illustrious Dr. Jinnie Kim Page. Enjoy and listen to the second half of our conversation. Have you read the book Atomic Habits?
No.
Oh, there's a great, have you, Corey?
No.
Oh, it's a great book. Sorry, I'm all about this self-help stuff because my life's so broken, or I'm such a shell of a person. I read this stuff. I wish I can talk about it on podcasts and seem interesting, but I don't actually embody it in my life. But anyway, there's this great anecdote. I won't talk too much because I'd rather hear Jinnie talk, but of this, I think he was Eastern European. This guy just wanted, his dream was to have chess masters as his kids. That's all he wanted. So he found a woman that he thought was intelligent, married her, they had children, and he made chess their lives. He had 3 daughters, and all 3 of his daughters became chess grandmasters. And not even it's not like this pathologic, like he's beating them with, chess pieces or throwing things at their heads or something. Like they actually grew to just live and breathe and love chess and cry that they didn't want to go to sleep. They wanted to play more chess. And he somehow just inculcated chess into his children. And they are the 3, I think the 3 most winningest female chess players in the world. So I just think it's interesting.
Well, whether it's resilience or talent, do you think, let's say for surgery, technical competence, judgment, that kind of thing, confidence, do you think these are skills that can be taught, or are these things that people just inherently have as personality traits or whatever? I'm so far removed from academics at this point, having been in private practice for 7 years. You being in academics, do you feel like an intern walking in, just being the clumsiest, no business in surgery kind of person? Do you feel confident that every intern that comes through can be molded into a good surgeon?
Can I answer that question?
And Corey too. Yeah, absolutely.
Well, I'm going to answer it this way. This is a question. So you're asking a very important question, which is talent when it comes to complicated tasks. And then Abhish is talking about nurture when it comes to complicated tasks. And I'll tell you this. Let's talk about surgeon. The thing that matters the most about if you're going to be a good surgeon or not, as far as actual physical talent, not mental, but physical talent, is what handedness you are. Because I'm left-handed. And so if you're left-handed, you have to work harder to be technically better. No, the reason I bring that up is because you could overcome that. So the idea is it more important to have that tenacity to overcome whatever it is? Or is it great to be at a certain level of technical proficiency to begin with? I think for me, at least for surgery, since it's so complicated and for instance, are you saying that the surgeon I am in 2026, laparoscopic surgeon or minimally invasive surgeon, would have made any difference in 1896? Would I have been a great surgeon back then? I think what it is to be a surgeon, what it is technically to be one, has changed. So there's no way that somebody's naturally gifted it as something that we don't even know what it looks like 10, 15 years from now. Same thing as for instance, here's another example. Going back to what you said about the chess masters, the idea that you just train somebody from the beginning of their lives to live and breathe a certain thing is the Tiger Woods phenomenon, the Serena and Venus Williams phenomenon. They're not naturally gifted at these things because these things didn't even exist for real. These are just made up things to be good at. And their parents made them good at it by saying, all right, well, look, we're going to take all your physical attributes, all your mental attributes, and focus it down this one specific pathway. So I think the more specific the task that you're learning how to do, the less talent has anything to do with it.
How long is it sustainable? So from a burnout standpoint, how long is that sustainable if you don't have passion behind it? Kid in chess practice or whatever for 10 hours a day, but if you don't love it, how long will they end up doing it?
I think burnout's a good thing to think about, but I think if you're really good at something and that builds your character, your ego up, then your burnout is less so to happen. And maybe that's passion, maybe that's not. but that's part of it. If your ego's tied up to what you do, and if your ego's not tied up to what you do, but you're resilient, as we've been saying, enough to not have that be a big part of who you are, then you won't burn out either, because you're like, it's easy for me to do this and do the things I really want to be remembered for, or be good at or enjoy. So,
Yeah. So what I tell the residents is, and I agree with you completely. I think without a passion and drive, you're not going to be able to sustain all the challenges that come with going through training. You will get burned out, you get tired of it. But what I tell my trainees is, I think it's a normal, maybe not a normalized bell curve, but there are people who are just naturally gifted and they have hands that they walk through the doors of the hospital on day one, and you show them something once and they can mimic it expertly. That group of people are going to be excellent surgeons. They can just show up, go to work. Imagine you, Jenny, are kind of like that. Um, Show up to work and just glide on through. You don't even really need to train those people. So then there's also people on the other end of the spectrum who can't move their hands and can't see tissue planes and can't make decisions in the operating room and freeze under pressure and are scared of the world around them, right? Those
Yeah,
people,
yeah. We
it's
all
not
know
right.
them.
Yeah. And there's everybody in the middle, right? And so the people in the middle are the ones that, you actually have to train and you have to teach. I can tell you the people who have some type of adversity along the way, I think end up becoming the best surgeons because if you don't have some kind of chip on your shoulder or some internal, like you have an internal drive for excellence for whatever reason. And that's, you know, going into the anatomy lab in the middle of the night is not something anyone else did, but you had that drive. But if you're met with some obstacle that pushes you to do that, like, oh, for me, it was, you know, not matching into surgery at first, right? So I had to work 10 times as hard to match into residency. So I think there has to be some kind of drive to help those people along. And I think they become the best surgeons outside of the ones who are already the overachievers like Jinnie Kim Page.
What about the ones that can't see the planes, that don't have confidence, that are just graduated through and become surgeons? Like, how do we support them?
Yeah, so I think it's a great question. I think the residents bring that up. Like, am I that person? Like, am I? Because the real challenge of training is that there's not like this perfect stepwise progression. Like I've seen, there are residents. I won't name names who I thought were horrible as junior residents. I was like, this guy or gal is not right. You need to go, go be a pathologist or do something. And then in their fourth year, just it clicks and
Yeah.
they're excellent
Yeah. I
and
agree. There's sometimes
they
that
graduate.
click that happens. Yeah.
Yeah, and they graduate and they're excellent surgeons. So it's a tough thing as an educator to say, like, yeah, as a second, third year resident, you don't have it. Maybe you should do something else because there are those people that just mature late. I mean, countless examples. So the problem is, you're right. Then they become 50 years, and half is if their last year of training, and if it hasn't clicked, you have some hard discussions you have to have
well,
because
this
people are
it's
out
it's
there.
kind of feels like this conversation we're having is kind of going into a lot of that. You remember Malcolm Gladwell's The Tipping Point and all those things, and about the twenty
Hmm.
thousand hour rule, and what was the other one he
Hmm.
had? Not it was a tipping point, and then outlier.
Outliers.
The whole a lot of these things. And the reason I'm bringing this up because we're talking about how do you have like great surgeons versus poor surgeons. It's all this outlier idea, which is like there's all these other like factors that are like don't seem to matter, but then they kind of do matter. Like for instance, would you have better surgeons next generation? Like not this generation, but next generation, because like the surgeon you become is not because of who you are and what you learn. It's also because of who taught you. And if who taught you was a crazy person who was, I don't know, xenophobic, racial, like misogynistic, and you didn't become the surgeon you could have become. I'm not saying any of the people that trained us was that. I'm just saying in the next generation you may have better surgeons on just because of that. And that's a factor that nobody could control for. And it's a factor that would definitely change the outcome of people's careers or what have you. So my whole thing is it's a multifactorial. When you're talking about something that takes 25 years to do, it's a multifactorial thing, and it has nothing to do with hands. I mean, you need hands, but it doesn't have to. It didn't have anything to do with
Well,
hands.
Well, I mean,
yeah,
with more and
Because,
more
like, for
robots
instance,
and AI coming in, our hands may become just secondary to the main robot that's doing it.
yeah, but my whole thing is
I
like, for
already do
instance,
robotic surgery, but
to be a surgeon, you got to be good in college. I don't know if that necessarily has like major in something that you can major in anything in college, but you have to do well in college, have to do well in medical school, have to do well on board examinations. That stuff is like 15% of being a surgeon. A lot of the stuff is, like you said, thinking on your feet. That has nothing to do with being able to take a standardized test. Um, Understanding principles that go into what you're doing, meaning how do I change, like you said, all the things you were talking about? How do I fill this void in a way that's not completely crazy or this doesn't make sense in the anatomical sense? But the thing is, all those other things, those barriers before, would have blocked people who would have been great at those things because they're part of the process. So the longer the process, the more complicated and intricate the process, the less talent has any purpose in it. Or I think so, because it's too many factors at that point. Like, meaning like,
So, so I was hazed in a way through the first 2, 3 years of my training.
mhm.
And you develop tenacity from like those hardships, right? Through intern year, through working 120 hours a week. Like you just, I don't know, you have to survive. And so I feel like that was a big part of how we became who we are. But I think the new millennials going into Gen Zs, like I heard from one of the attendings at Emory that there was an intern who came to an attending who said, I'm going to need you to teach me in a different way because you're not doing a good job. Like, I can't even imagine when I was an intern going to an attending and even talking to them, right? And so I feel like there is like, boundaries are very delineated by these generations. And like, I just don't know how people will be trained and what kind of doctors they'll become. And so I'm really curious, like, what the future of medicine will hold, because it's certainly not the the doctors that lived through the 80s and 90s and 70s and, like the people that trained us, that's not how medicine works anymore. And we're kind of in that in-between zone, like as late Gen Xers, early millennials, we don't really belong in either group, but we're certainly not the future anymore. The future is now here. And so where will that take medicine? I don't know. I'm really curious.
There's this idea that the newest generation, they're less social, they don't take criticism as well. But there's a flip side to that, which is they do more than we did, and they are more capable of doing more. Like
Yeah,
so the whole idea is like that's a dichotomy there. Like, you mean we can't yell at them, but if you don't yell at them, they'll do more work than I did. Like, and like,
I
are they more
imagine they're more
productive?
resourceful,
They're more
right? They're
productive or
more
more
resourceful.
resourceful. So like that.
But I think the way that we communicate with them will probably be different than how people communicate with us or how we talk with each other. Like, I think we all speak very different languages, not just like the slang, but just in general.
is it okay if I say something?
I'm going to be
I
honest. For dueling scalpels, I thought there was going to be more controversy. I feel like I've just like made this like this soft podcast and I'm a little bored because of the lack of dueling here.
Oh, you
So I want you guys to come up with some more.
we're doing because this guy's talking over me as I'm literally speaking.
No,
Well, what I
let's
was
talk
gonna
about something
say,
spicy.
since one of us actually interacts with this generation on a daily basis as part of their work,
do you interact with them well? Do all
I
interaction?
do. I think I do. I have not for a big part of my training. I can honestly say that I trained residents how I was trained, which is wrong, because they'll react how Ginny's friends did. But it's different, and I think it's interesting because I would count the three of us as very competent people. I remember all three of us went to residency, even me who didn't match, thinking that we're gonna like crush the surgery thing. Like this is gonna be great, and the universe is lucky that we're gonna be in it. I remember the first time I did an umbilical hernia repair, and I was like, I made it. I'm like good to go. My very first operation, and this generation is very, very different. There's a lot of insecurity. Um, they just think differently. Everything is very calculated. And I think when things come across like how your story went, Jinnie, I think a lot of that comes from deep-seated insecurity and fear and anxiety, and it manifests in this kind of entitled, insane way that I don't think is at all intended. But I also think they're very practical, and like what you're saying, like you described it as hazing, which I think is pretty accurate for I think the newer generation, everything has to mean something. They need to understand why. And you can't
I
just
can see
like
that.
go through it,
Yeah.
and say, you're hazing, we're hazing you, enjoy it. And you'll build resiliency and this is part of the process. Just go with it. Like, no, no, no. Why do I need to do this?
Yeah.
What does hazing do that makes me what I need to be? And then you explain it to him, like, okay, cool. I'll get hazed. Let's do it. So I think and I kind of dig that because in a way, it's kind of nice because it's like you said earlier about having a challenge. It's like if everybody was just good and put their heads down and operated, that's not really much of a challenge for an educator. It's not very interesting. We just operate in silence, and you can scream and act however you want in the operating room as a teacher. But if you really have to think about people's technical growth and their psychopathy and how they think about being a trainee and what their fears are, I think it actually makes it kind of interesting. But both you guys are everything you've already said is true. I do think I had no idea all these years Corey was a left-handed surgeon because the systematic bias against left-handed surgeons runs so deep. It's a real challenge to train a left-handed surgeon. So
But it won't be, right? Like in 15, 20 years, it won't be because, I mean, if you're doing robot, it doesn't matter what hand you are. You can switch that out easy
Yeah.
enough.
that it's less of a certain. I mean, it's what I do 90% of the times. Let's not talk about it like it's
No, I'm saying
inferior.
that the handedness isn't as crucial to that kind of. It's not as crucial in a laparoscopic surgery because you can switch the instruments and do it your way. But open is a little bit more. The handedness matters.
The whole setup is built for right-handed surgeons
Yeah.
on both sides of the table.
I understand that, but okay.
I mean, that's what I'm saying. I'm agreeing with you.
Yeah,
We're not dueling. I'm agreeing with you.
my whole point is that as things get more and more, as you get more and more removed from your hands, actually, like it's just like there's no left-handed video games. I mean, like the idea is like the more abstract the movements come from your hands, the less the handedness matters. But it
Yeah.
does matter. And the thing is, like, since it's biased one way, you're at a natural disadvantage. And that natural disadvantage isn't, I mean, that doesn't mean that the world's best surgeon is not left-handed. I don't know who the world's best surgeon looks like, actually. I don't know what handedness he is, but I was just using it as a,
Left.
really?
He's left. Yeah.
He's probably ambidextrous,
That's
right? He's probably ambidextrous. He's probably
Yeah.
just gonna, like,
I
just,
Because that's what has to happen. If you're left-handed going through training, you have to learn everything
yeah.
right-handed, and then you're just more ambidextrous.
well, the
She
other,
will be holding a needle driver on one side and a scalpel on another and be doing everything. I mean, everything together like this. No one will understand what was going on.
The
It
thing
just
is-
all happened.
but you actually, like, as a left-handed guy, I actually think about the steps very, very hard because I'm like standing in the wrong direction or standing in the wrong place bothers me because I have to think about that anyway. And so when somebody does it, it's like how you feel like how kids don't know which foot they're putting their shoe on because like it should be natural but it's not. Like that's the feeling for me. It's like now that I have to think about this, now I can't unthink that that's something to think about.
Goes back to my comment earlier about that's building resiliency, right? Like you're overcoming a struggle, and you have to think more critically. If you're just kind of good at operating, you don't think about the steps. You're just like, oh yeah, I see the planes, I know what to do. This makes sense. But I think that process of having to think through it is the value, right?
Yeah, yeah.
And then you understand it.
Yeah, yeah.
Um,
Do you think so? We
I,
had
I know
another question. We
you,
we had another question for you, Jenny. Do you
yeah,
think there will be general surgeons in 15 years, like the board certified general surgery that you, me,
He's so mad. He's so
and
mad about general surgery.
you, me, and
no,
no.
no. So I don't know what you cover in episodes 5 and 6, but I don't think so. So I don't know. So in academic centers, everyone is fairly specialized. And in employed settings, like at Andrews Hospital, or I mean, even in private practice, like there are people who like to have their niche practices within general surgery, whether it's bariatric or foregut whatever, or colorectal, or whatever it may be, right? Everyone kind of specializes in their thing. And so then that leaves like this big, vast umbrella of acute care surgery. And acute care surgery over the last 5 to 10 years have become its own thing, right? So that's what general surgery stemmed from. And everyone also had an elective practice in addition to that acute care surgery. But in terms of having a perforated gallbladder or perforated viscus or some disaster coming to the ER, and now it derails your whole elective day when you had 3 or 4 or 6 hernia repairs to do, and somehow you have to fit in this 5-hour surgery of like some abdominal disaster. It's not really a good system to keep people happy. And so they've converted over to this shift work of ACS, of acute care surgery. And so I think that's kind of where a lot of that will go. So who goes into acute care surgery? What is attractive about it? Well, it's shift work. And so you don't have to think about building a practice, about networking, like whatever comes to the door you take care of. But you can also work like 2 weeks on, 2 weeks off. And so if you wanted to live in Vermont for all summer and in Arizona for the winter, like you can make that happen being an acute care surgeon. So there's a lot of flexibility in that field. You know, sometimes you think people who don't have a personality or who don't have the skills to make it in some other field, those are the ones that go into acute care surgery. Like it's not necessarily that. Like there are real attractive features about that field that would draw some talented people too.
Yeah, I mean, Corey made that almost exact same point, and I think it was episode 5 or 6 that you didn't listen
My bad.
to. But
I didn't
no,
do
I mean,
all of my
it's
homework.
validating, but I gotta say though, like, I feel like we've been saying this since we were residents, and that was like, what, 15 years ago? Oh yeah, like, acute care surgery is it. There's not gonna be general surgery. I think the the universe is dictating the fact that it still exists.
With incorporating AI and maybe even physician assistants or nurse practitioners, maybe a lot of the hospital positions will be replaced by more automated things. I don't know. Here's
But that's
okay.
where the
So
bad things live, though. The bad things live at the ED. The bad things live at the hospital. So if all the doctors are not dealing with the bad things in medicine, then are we doing medicine anymore? Like that's the other part
yeah.
of it, right? Like all the
So
all the things that are like the things that are really going to put somebody's health in jeopardy that we can actually acutely intervene on happen in those scenarios. And my whole point is, if you push all that away from the people who train, then what are you left with? Like, meaning, like, if you replace all the, like, for instance, how they're doing with the ED, where they're replacing all the ED doctors with PAs and nurse practitioners, is that better for society? Because that's where we are. Because we're like,
yeah, I don't know. I mean, so there are what, like 1.1 million doctors in the US? And how many hundreds of millions of people? There's a physician
340 million
shortage,
people.
right?
340
Yeah, there's
million
a
people.
physician shortage and it's only going to get worse. Um, One thing I'm interested in as a female in medicine and female in surgery is the number of females going into medicine has only gone up over the last 10 years, 20 years. The number of females going to surgery has only gone up, right? And so I'm sure there is data now. I don't know that the literature, but I'm sure there's data now looking at what fields are best suited for women in medicine and women in surgery. I don't know if, like thinking about work-life balance, someone did say to me, actually multiple people said to me during training, like, you probably want to go into this field so that you can have kids. I'm like, that's not true. That's not me at all.
Yeah.
But that was the assumption that people made, right? And so, people who may not think about going to neurosurgery or some other surgery where it's known to be more malignant, as a female, like are these fields like ACS or, like are those what would make it easier for surgeon moms to have a good balanced career and life? I don't know. Or they just become plastic surgeons where they can like have a lot of control over their time. I don't know.
Yeah, I mean, I don't know. I don't know that I would and ascribe it necessarily to a gender. I think everyone in this generation wants some work-life balance, man or women. Most of my trainees are women. 90 something percent of the residents at UAB are women. Um, and I don't, it's in talking to them, it's a consideration, but they
Well,
do thoracic, they do
yeah.
vascular, they do.
I
I
think
mean,
it
I
was
think
like a weird window. Like, I think we were in that weird window of dealing with attending surgeons who didn't know what to do with women. And now the women who are going into medicine know exactly what they want out of their jobs. And so I think we were kind of in that weird, brief, ambiguous window of people they didn't know what to do with. And we just kind of made it happen, I think.
oh, I agree. Yeah, I mean, now it's just training. So
Well, like I said,
there's a
I think what you're saying is interesting though, as far as like, do do they have to make certain parts of medicine that need to be done more attractive to the people they want it to do it? Meaning, like, if you want somebody who's going to spend their 20s doing the training for it, should the job look like an 80-hour a week job, or should it look like a 40-hour a week job, or should the pay be different? And the reason I bring that all up is because I think what I saw in my generation was that medicine was losing its luster as a career. Meaning, a lot of people thought being a computer engineer, which has that's really fallen off now. But back when I was in college, being a computer engineer was probably your best bet because you could go to Microsoft, Google. This is 2003, 2004, 2005, and have even if your career was only 15 years long. I mean, your stock options had you net worth 7, 8 figures, and they were like, "Why go to medicine and dedicate your life to that nonsense? I'm gonna be wherever I am."
I know. I wish someone would have told me that I could choose a different career where I could work from the south of France every summer or wherever and travel and see the world and still make a living. Like that would have been awesome.
So,
Now, while I love my job, I'm completely stuck in one city.
well, my whole thing, the reason I bring that up is because you're right about that transition. Like our generation is that generation where we're the last generation who I think may have seen medicine in with a golden view of it because it still was this prestigious thing that you could do.
I think even in this conversation, I've gotten a lot of clarity in that because if I wanted to be a travel blogger and I loved medicine, I can find something that I can find easy shift work, whether it's in medicine or surgery,
Mm.
do that, make money. If I wanted more money, I have a side hustle or I double up and do more shifts. But it's titratable, right? You can work as much as you want, or you can travel as much as you want. You can make it as much or of your life as you want, or as little as you want, because the need will always be there.
Oh, can you ask her a rapid fire question about what's the most overrated instrument in surgery?
I can't now. You stole it from me. Fine. What's the most overrated instrument in surgery?
Uh,
Rapid fire. We're doing it.
Debakey in my world,
Why?
because there's always either something more precise or sturdier. Like, who needs a Debakey?
That was my number two.
What was your number one?
The scalpel.
Scalpel. I use it all the time. Why do you
Yeah,
not need it?
because we don't need it. Laparoscopic surgery, you don't need it.
But what about those little incisions?
You can make that with a bovie. Boom.
I know, right?
You would never say that to a plastic surgeon.
I just did. I just did. Boom. It just happened. Like
All right. What's your
that.
another rapid
Well,
fire
I said the
question?
bacon,
Well,
and
this
he's
is too
what
deep.
did you say?
I said nothing because I do robotic
What's
surgery
your
and I can use this
favorite,
stuff.
top two favorite instruments?
Like, do they have to be open instruments? Or
Whatever.
can it be?
Just whatever.
I like a
I mean, the
I
robot.
like
Yeah. You can call the robot. Did you name your robot at work?
No, I'm not that kind of person.
When you sit there and
That's silly.
straddle it, you don't call it a name.
He's not that kind of guy. He's just a guy who just straddles random
No,
machines and
I did ask the rep if I could have my name stamped on the side of it, like in Top Gun, like Maverick and Goose, but
Yeah.
they're like, oh, but they have the UAV
Well,
stamped on
I
it.
have a microscope. I guess I could name him or her.
You could
Gaze into
be
its
that kind of
eyes
person if
for
that's
hours
the
at a
kind of
time.
person you want to become. Corey,
oh,
do you have a favorite?
I like a laparoscopic needle driver, man. I'm not gonna lie to you. It's pretty useful
A
instrument.
Jarrett? Do you use a Jarrett needle drivers?
Yeah, it's pretty useful little instrument there. I like it, but it's so situational. It's hard to say it's the most
That
useful,
or
but it's my
Hunter
favorite.
Graspers. So another question. This is supposed to be rapid fire. I guess whatever. Aura music, silence, or what music do you listen to?
There will never be silence in my OR.
Good.
So,
Those people are weirdos, by the way.
yeah,
I do
yeah.
silence sometimes.
So,
What are you trying to say?
Weirdo.
why?
Well, look, there's a
So,
couple
like
things about
anything from the
that.
90s.
Okay.
90s
Let's
hip hop
find
on
out
some
like
days,
Corey's
90s R&B sometimes, 90s pop sometimes, 90s
that's
alternative
that's
sometimes.
that's egalitarian. That's everybody loves that stuff. Go ahead, Corey, you want
So
to explain to the
first of
world
all,
why
I
you're
never
weird out?
choose the music because I do not care. But here's the reason I don't care is because there's generations involved in these ORs. There's a generation ahead of you, your generation, and a generation below you, and I do not care which generation it is, as long as I'm not the one offending the generation that's getting offended by the music that's playing. I didn't choose it. The scrub nurse chose it, or and so I don't really care what it is. 80s, 90s, 80s, 90s, and today, which is 2000, 2010s, and 2020s. That's fine with me, but honestly, I don't care. And the reason I don't care is because it's more trouble than it's worth for me. But I understand. There's bad music though.
I
There's
usually
definitely bad music. Country music's bad. Rap is bad. Gregorian chants and classical music is bad because it just rubs everybody the wrong way. No matter if you're a fan of
yeah.
those kind of genres, it rubs everybody the wrong way. It has to be down the fairway. And my whole point is, if it's down the fairway, I don't really care.
So, when it's just like kind of like just sewing and not really much more, but like 1,000 deep dermal stitches and literally miles of skin to sew, then it's not like I have to be focused doing something that is so routine. And so, yeah, I'm going to put on some Mariah Carey and sing at the top of my lungs. Like that just happens, right? Is that unprofessional? I don't know. Is it?
You sing in the OR?
Yeah.
You don't sing in the OR? What's wrong with you?
So,
I sometimes I'll
So
sing,
that's
but
the
I
key to
also know
burnout,
that.
right?
well, no. Here's the
You
thing.
have
So,
to
like,
sing more in the OR.
but well,
Well, I mean, yeah, it goes back to what we do as surgeons. Like, I
Yeah, I
mean,
guess that's true. You guys
patients
are
are
like
always
saving
right.
people. I'm just,
No,
no. It's not.
I don't think I say that at all. I think it goes back to like, patients are always like, oh, did you sleep or did you have a good breakfast? Did you get your coffee? I'm like, yeah, but it's like this, at a certain point, it gets really mundane what you do. I mean, it's like, that's why we're talking about what makes it interesting. Like, oh, there's some weird complexity that this hernia is this or the tissue's like this, and that makes it interesting. But everything else is your brain is like off, like it's a flow state, right? So that's where music is kind of whatever. I mean, that's why I tell my trainees, it's like they actually have to think about this stuff. Like Corey was saying when he was learning to be less left-handed, they have to think about like I'm not thinking about anything. I'm thinking about what's for lunch or
the music is one of those things, music, good conversation. Those are things that get my brain stimulated to where I feel like I can think more clearly and things just kind of show itself more. I don't know, like the world just seems brighter.
yeah. Except, unless you're with Corey, then the world is dark.
What are you talking about? No, I don't have the music part. I don't have a problem with it. I think music does help camaraderie within the OR, especially if you pick the right music. Meaning, like everybody feels like we are all on the same page and we're moving in a certain. That's why it has to
Yeah.
span generations. Because if the 60-year-old's like, "What is this? This is loud and awful." Justin Bieber. If you're like singing Justin Bieber and the CRNA who's 50, 60 some years old is like, "Why are we listening to this?" I think
What I do is
I think that's bad.
Yeah, I find the meekest person in the room and be like, "Yo, what's your story? You pick the music." Like the nursing student in the corner that's like, "Oh, I'm so scared." But anyhow,
That's a
um,
good idea.
one operation you'd happily never do again, Dr. Kim Page, or
Sacral
glad that you
decubitus
never do.
debridement.
It's always the but. I knew it. It's always the but. I told you this. I said this. He asked me. I said it's INDs of paraanal abscesses. I could go my whole life and never touch another person's butt in anger for money ever again. But I knew it was gonna be that. See, that's what I'm telling you.
Yeah.
I mean, Corey's right. That's why he's on the podcast. That's
Yeah.
why
But it
we
is.
brought
With
Jinnie
that being
Kim on
said,
here.
though, we
Page.
talked about this too. It is rewarding though because when you drain that for people or you fix somebody's backside, they are grateful. They are so grateful that you fixed their backside.
Yeah.
So there's that part of it. But it's miserable for everybody concerned. Nobody wants to be there. Nobody. Patient doesn't
All
want to be
right.
there. They're not happy.
One thing every resident should stop doing immediately.
Comparing themselves to someone else.
Oh wow, that's great. That's the right answer. It's amazing. The number of conversations I have with residents being like, "Hey, am I okay? Am I as good as so and so?" I'm like, "Oh man, just move on."
I think in
All
general, it's
right.
not just residents though. Like even as surgeons, don't worry about what everyone else is doing. Just do you and at the best version of you. That's it. Someone was
Love it.
asking me, would you mind, like, would you be okay teaching even local surgeons this one technique? I'm like, it's not a competition. Like, we all do what we do. And if we can do something to help the patients get better or like have an improved technique or whatever, like, yeah, absolutely.
Let's try this. How about some plastic
I will
surgery
also
myths?
say the later it gets, the weirder it gets. So I kind of like this.
Surgery after dark.
Yeah. Hey, that should be a separate podcast. Hey, do you want to be on our show?
Uh,
We meet at midnight.
Liposuction is a weight loss procedure.
No.
No, terrible idea.
Terrible idea.
Yeah.
Why not?
As a weight loss procedure,
I
Yo,
mean,
there are
hey,
so many easier and cheaper ways to do
how
it.
much fat do you think they get out with liposuction is the real question. So like let's say you how much fat do you think?
So
I'm asking
when
the
you
beef.
lipo, you're lipoing like certain body parts, right? And so if you had like the tiniest waist but the fattest arms, like it's not proportional. It doesn't make sense.
But
If
Jenny,
you
how
have like
well,
thick
it
necks,
doesn't make sense on the. What about central adiposity? Like that's what I'm actually pretty muscular everywhere else except for my gut.
okay, so that's not a weight loss, that's a body contouring procedure. So the question
Yeah,
is
yeah.
faulted. Yeah.
what how
Okay.
much how much how much weight
Excuse.
can you take off in a liposuction as far as fat? A few pounds? Most?
So you shouldn't take more than 5 liters at a time if you're doing it as an outpatient procedure. You can do 8, 9 liters at a time as long as you keep people overnight to watch for fluid shifts and electrolyte imbalances and that kind of stuff. So,
8 9
um,
liters and fat. What is fat? Fat is going to be less than water, so that's 9 pounds.
yeah, it's not a pound reducing
I know,
procedure.
but that's why I'm
Yeah.
trying to for the
Yeah.
people at home.
Same with like breast reductions. So people who have these massive breasts, they're like, how much did you take off? You're like, well, it was like a pound and a half. Like, that's it? I'm like, that's actually a lot of weight. But, it's like lipo, skin excisions, like giant pannus excisions. It's not it's not like 30 pounds, even though it feels like it when you're carrying it on you. It's not really that much weight. It's not a weight loss procedure.
What do you think is the next best innovation in plastic surgery?
Um, that is a great question. I mean, if there was a way to reverse aging, that would be it. So it's not going to be something surgical. It's got to be something systemic, whether it's a peptide of some sort or whatever, where you take it and it reverses cellular aging. right? And so that will be the future of plastic surgery.
It's Brian Johnson. You guys know about Brian Johnson? YouTube Brian Johnson. This guy is he's a some kind of entrepreneur billionaire who's trying to reverse reverse engineer his body and keep himself from aging. He's exploring all these interventions. Interesting guy. We should have him on the podcast one day.
Yeah, let's do it.
Would you rather never use cautery again or never use magnification again?
That's terrible.
Ooh. I know. That's why it's a great question for you.
I can't do either. I suppose I could look very closely to do my micro. I would
Yes.
say I would.
I
I would.
assume there's a reason to use the magnification in those operations.
So I cannot do any case without cautery, but I can eliminate cases without magnification. Like if I can't do a micro case again, there will be someone who can do it. So I would say I would stick with cautery.
I would. Cautery is one of my favorite things, but it seems like you could get away from it and just, have to stick tie every bleeder, and that be your life. But if
I
there
don't know
there
that
are
I've
literally
stick
cases
tied
you couldn't
anything
do.
in 7, 8 years,
You're living
but
good.
I
You're living really good. You're living
I mean, it's
great.
all
You are
microvasculature,
living
right?
those.
Good.
You're living a great life if you haven't had to throw a stick in something that the cautery wasn't gonna fix. I commend you, my friend.
All right. Should we think about wrapping this up?
sounds good.
Do you want to do a closing question for Dr. Kim? Did you have a closing question
You
in
mean
mind,
Dr.
Dr.
Page?
Campbell? Dr. Page?
I don't know who you've been talking to,
Next
but
podcast, we make sure I know
Okay,
the name of the person.
can AI
Corey.
fix that?
Corey, if you were 21 years old,
Yeah.
what would you choose leaving college to pursue?
You talking about 21 now or 21 in 2003?
21 now, knowing what you know.
Ooh. I don't know, man. I mean, like, I like surgery. I mean,
Abish, what about you?
It goes back to everything we've already talked about, how you shape your reality, whatever you end up doing. I mean, I don't have any regrets about do I get burned out? Am I tired of things from time to time? Sure, but I
Don't you
think
think
I
that would be
think
there with any job?
exactly. So it's magical thinking because I could pick, I don't know, being an artist or a firefighter or something exotic and say, oh, that might be better, but
I would
there'll be
think
some
some people would call surgeons being exotic too. Like you cut people open and mess around with their insides.
absolutely. What we do is incredible.
uh,
So, what
that
about
that
you?
is a do-over, right? Like, meaning don't do the same thing, right? So, like, you can't do the same thing. You've already
Yeah,
done that.
I mean,
Okay, sure. Okay, so if we
So,
chose something not what we do,
man, I think it would still be technical though. Like, it'd be science based. It'd probably be like, I don't know, man, mechanical engineering, rockets, man, rockets. I don't know. I think
well,
it.
I almost became a religion professor. So I'd be some kind of teacher, I think. I think that's my real passion. I mean, surgery's fun, but being an educator and figuring out these residents, it's actually what I think really drives me and keeps me from getting burned out. So, a professor of something.
I don't know, man. Like, the thing about all these things, like you said, is this whole sunk costs versus opportunity costs. It's hard to really gauge that kind of stuff because I don't know what it's like to be in college now. So I don't know how I would have reacted to the college that is there now. Like, meaning like 2003 college. Oh, it was definitely computer engineering. I would have been a computer engineer. Everybody was doing that. It was like computer engineer, Wall Street, all that stuff was sexy. Like, but that's dried up, and I don't know what kids find interesting in college now. Like, college is completely different. So what do they? What's sexy to? What's sexy now?
It's Dr. Page's
It was Dr.
answer.
Page.
mm,
She'd have been an architect.
I've
And let's
always
let's
wanted
be
to
real.
be like a big production set designer, like the Oscars or something like that. Like something temporary, but like you put something massive together and orchestrate it all. Like that would be really fun.
Do you major in drama for that? Is that drama?
No clue. Not surgery.
I think that's drama.
Well,
I
I
think
mean, you can see it. That's plastic surgery, right?
Yeah.
It's putting things together in an artistic way.
Yeah.
Well, Jinnie, thank you so much for coming on to the pod.
Jenny, thank you
Hopefully
so
it was
much.
fun for you.
We really do appreciate it.
I think you shed a lot of excellent insight into the world, as you always do. It was a
It's
pleasure
good to
having
see
you.
you guys. Let's hang out.
Definitely. Thanks.